This is the nervous system starting on page 247 with the anatomy. The central nervous system consists of the brain and the spinal cord. The peripheral nervous system includes the nerves that carry messages to and from the brain and spinal cord. Spinal nerves carry messages to and from the spinal cord, and the cranial nerves carry messages to and from the brain. Our terminology, combining forms, meanings, and terms. First, we have cerebello. This means the cerebellum. So cerebellar is pertaining to the cerebellum. Cerebro means cerebrum. So cerebral is pertaining to the cerebrum. Encephalo means brain. So encephalitis is inflammation of the brain. Medullo refers to the medulla oblongata. So medullary is pertaining to the inner or soft part of an organ. Myelo is spinal cord. Myelitis is inflammation of the spinal cord. And neuro is nerve. So neuropathy means disease of nervous tissue. Our pathology section of the nervous system, we have Alzheimer's disease. This is a brain disorder marked by deterioration of mental capacity, irreversible dementia. Cerebrovascular accident. This is damage to the blood vessels of the cerebrum, leading to loss of blood supply to brain tissue, also known as a stroke. Concussion, traumatic brain injury that can cause bruising, damage to blood vessels, and injury to nerves. Loss of consciousness may occur. Epilepsy is chronic brain disorder characterized by recurrent seizures. Glioblastoma, malignant brain tumor arising from glial cells. Blast means immature. Hemiplegia is paralysis that affects the right or left half of the body. Meningitis, inflammation of the meninges, the membranes surrounding the brain and spinal cord. Migraine, attack of headache, usually on one side of the head, caused by changes in blood vessel size and accompanied by nausea, vomiting, and sensitivity to light. Multiple sclerosis is destruction of the myelin sheath on nerve cells in the central nervous system, the brain and spinal cord, with replacement by plaques of sclerotic or hard tissue. Paraplegia is paralysis that affects the lower portion of the body, from a Greek word meaning to strike on one side. This term was previously used to describe hemiplegia. And then we have syncope. This is fainting, sudden and temporary loss of consciousness as a result of inadequate flow of blood to the brain. Next is our laboratory tests and diagnostic procedures section. We have cerebral angiography. This is X-ray imaging of the blood vessels in the brain after the injection of contrast material into an artery. Cerebrospinal fluid, CSF analysis. Chemical tests for sodium, chloride, protein, and glucose. Cell counts, cultures, and bacterial smears on samples of CSF to detect diseases of the brain or meninges. A lumbar puncture is used to remove CSF for analysis. Computed tomography, CT scan, cross-sectional X-ray images of the brain and spinal cord with and without contrast. Electroencephalography, or EEG, recording of the electrical activity within the brain. A lumbar puncture, LP, introduction of hollow needle into a space surrounding the spinal cord to withdraw cerebrospinal fluid, CSF, for analysis. Pressure of CSF is measured and contrast may be injected for imaging, myelography, also known as a spinal tap. Magnetic resonance imaging, or MRI. Magnetic waves and radio frequency waves are used to create images of the brain and spinal cord. Positron emission tomography or PET scan. Uptake of radioactive material into the brain shows how the brain uses glucose and gives information about brain function. Next are our treatment procedures for the nervous system. We have stereotactic radiosurgery. This is a non-surgical type of radiation therapy used to treat abnormalities and small tumors of the brain. Also called cyberknife or stereotactic radiotherapy, this treatment can deliver precisely targeted radiation in fewer high-dose treatments than traditional therapy. And then we have transcutaneous electrical nerve stimulation or TENS. A battery-powered device delivers stimulation to nerves to relieve acute and chronic pain. And our abbreviations, we have AD, Alzheimer's disease, CNS, central nervous system, CSF, cerebrospinal fluid, CVA, cerebrovascular accident or stroke, EEG, electroencephalography, LP, lumbar puncture, MS is multiple sclerosis, TENS is transcutaneous electrical nerve stimulation, and TIA is transient ischemic attack, temporary interference with blood supply to the brain, also known as a mini stroke.